rarely does a patient come in just for a simple implant exchange. If they've had their implants in for some time, you're going to need to correct something. You can't just always take a much larger implant out and then put a smaller implant in. It looks kind of like what we call a rock in a sock, or just very deflated and not very aesthetically pleasing. So oftentimes I will have to talk to patients about a breast lift, and unfortunately that does require some incisions on the breast. But I tell patients it's a trade-off between the look that they want and the shape, and the incisions we minimize by the use of, kind of meticulous surgical technique and dissolvable sutures. But in my practice, I also use a device called Embrace, which helps to minimize scars by up to 60 to 70%. Doesn't eliminate them, but can certainly give patients a much better appearance to their scar, and the satisfaction rate is very high. It's an adhesive device that's applied to the incision a week or two after surgery. Decreases tension across the incision, so it decreases inflammation, elevation of the incisions, and the appearance, the discomfort. Patients have a better scar outcome, and they report kind of when they're wearing the device that their incisions feel more secure and more comfortable. Sometimes what we have to do is bridge the gap between what patients want and what it's going to take to get them what they want. And sometimes that means incisions. And so we educate them, show them pictures, and then really kind of let them decide, which direction that they want to go in.